So the standard definition of value-based care is outcomes over cost. And that's usually measured in clinical outcomes. Now, clinical outcomes can be a wide spectrum of things. In oncology, sometimes it's overall survival after a cancer diagnosis. Increasingly, in our cancer center, we're focusing on additional outcomes, outcomes that may be more important to patients than fairly standard clinical outcomes. So functional outcomes. After a given procedure, are you able to carry on normal daily activities? Other outcomes that we're looking at are outcomes that we think might reflect how to manage a patient's cancer journey. So I think that much of the fear and concern about having a new diagnosis of cancer happens in the first few hours, days, weeks. And we're focusing significantly on trying to manage that to the best of our ability. One way that we're doing that is to try to speed up how long it takes a newly diagnosed cancer patient to get treated. We're calling this time to treat. And historically, it takes a fairly lengthy amount of time, several weeks, for patients to receive their initial therapy. Patients have to go from point A to point B to point C. That's frequent that not all services are provided in the same location and not all physicians see the patient at the same time. Coordinating care is a challenge. It's actually a pretty complicated issue. One of the striking things is that the famous academic medical centers do worst of all healthcare providers on this metric. We do significantly worse than do community cancer centers. And so there is an enormous opportunity for us to improve that. And I think we will, I think we can, and I think by doing so, we can, in my opinion, significantly alleviate a lot of the fear and anxiety that happens to patients and their families with a new diagnosis of cancer.